One of the biggest mistakes I see pet parents making is waiting longer than they really need to seek out hospice and palliative care for their aging or terminally ill pet, when we really could have helped them out a lot sooner and probably provided more services to maximize that pet's comfort and well being. I think this happens because there's some fear and misunderstanding around what hospice and palliative care are. So, today I would just like to address some of those misunderstandings and hopefully lower some of your barriers to seeking that care that can really make things a lot better for your loved one. The first misunderstanding is that a pet has to have a terminal diagnosis in order to receive hospice or palliative care. Let me back up a little bit and give you some definitions. Now, palliative care is medical care that's focused on the physical, social, and emotional well being of the pet. So it's comfort care. And then sometimes, if a pet is terminally ill, we will use the term hospice. I generally tend to avoid that in our practice just because of some of the feelings and connotations that we have around hospice care. And really, in vet med, the goal of the two is the same. We're really trying to maximize that pet's comfort and make them live as happily and fully as they possibly can. This doesn't have to be at the end of life. My favorite example of how palliative care can be helpful for pets that have chronic disease but aren't necessarily in the dying phase of life is arthritis. So there are many treatments now to address the comfort and the lack of function that can come with arthritis, which is very, very common in senior pets. So there are pain medications and physical medicine and sometimes even changes to the environment and the pet's lifestyle just to make it easier for them to do their daily activities. And this kind of care can be provided for years. The second misunderstanding that I hear is that we have to give up on doing any life extending or curative care for pets that are receiving palliative and hospice care as well. I think this comes from how hospice works in human medicine in the United States. So, here in the US, Medicare will pay all of the cost of hospice care for human patients, but they need to have a prognosis of 6 months or less to live. And they have to sign off and say that they will not pursue any more life extending or curative care. In veterinary medicine, because the government is not footing the bill, we don't have that limitation. So palliative care can be brought in much earlier. My favorite example of this is patients undergoing cancer treatment. So, cancer, as we know, can cause symptoms that affect the pet's comfort and well being, and sometimes the treatment can as well, especially if we're talking about chemotherapy or radiation therapy. So, palliative care just means we're looking at those symptoms and the side effects of treatment and offering treatments and ways to deal with those side effects. So, they can go hand in hand and actually complement each other. The final misunderstanding, and I think this is the one that really gets at the root of the reason people put this off longer than maybe they should, is that we think that choosing hospice or palliative care means we're giving up on our loved one and we're accepting that they're going to die. And that can make a really difficult mental shift. Of course, we want our babies to live forever, but I encourage you to take a different mindset about this and think of it as really embracing the time that you have left together and making sure they're as comfortable and happy as they can possibly be for that time. So it's not giving up on life, it's really embracing it and trying to make this time, whether it's days or weeks, months, years, as good as it can be for the both of you. Now that you understand some of these things, I'm hoping you're a little bit better equipped when you recognize that your pet is experiencing symptoms that might affect their quality of life from a chronic disease or a terminal illness. You'll reach out to your veterinarian and talk about whether hospice care might be a good option for you. My name is Carolyn Nawn, and I am the owner and medical director of Arms of Aloha, where we believe every pet deserves peace, comfort, and dignity at the end of their life. If this was helpful to you, please do share it with your friends. And if you have comments, drop them in the notes below. Mahalo.